Hey crew, what's up? This is Shelby Blankenship, one of your TAs and fellow physical therapists with the older adult division. Today, we're going to be talking about electrolytes and their relationship with osteoporosis and kind of seeing what ways we can optimize this micronutrient for our folks and at least give them some insight or some clinical pearls for you to kind of chat with their doctor or them to talk with their doctor. So, the first one we're going to talk about is the most obvious one, and that's calcium. So, especially with calcium, like it is primary role is for human skeleton. So we want to make sure that there is a lot enough calcium for these folks to kind of maintain that bone integrity. But there is subtleties in how much or how little we need to have. If we have too much, it can cause issues. Obviously with it it can cause some issues, and then if there's not enough, it can have to pull it from our bones to create that necessity, and it can create a little bit of a loss in that bone integrity, and then that can create its own issue with, of course, osteoporosis being on board. There's also a really good relationship with phosphorus when it comes to this, and that's also another micronutrient where you can have too much or too little, and that can cause some issues for bone density or other health related activities. Now, as far as how much calcium we should be having, usually about 1 gram is kind of what we're shooting for each day. Calcium supplementation can come with some risks of constipation depending on the type of calcium that you're using. So, kind of just be mindful of that. If you're advising people to increase their calcium, it is best if we can go more of a dietary aspect versus just pure supplementation. So, just kind of be mindful of that. Definitely do your research as far as if they have any specific comorbidities on board or have conversations with their doctor in regards for calcium. Now, we're going to kind of segue into the other big four that I like talking about, which is the magnesium, potassium, sodium, and zinc. So, we actually sell Element at our facility because we love that it has magnesium, potassium, and sodium in it. And there's always some pushback sometimes when it comes to the amount of sodium. And there's actually like new research coming out showing that the relationship between sodium and like high blood pressure, which used to be like the thing, is not as correlated as what we had originally anticipated, especially if somebody tends to be on a diet that is not super high in processed foods. They're usually not getting enough sodium. And then if they are getting, maybe they are eating a lot of processed foods, usually it's the like phosphorus portion that can be a big problem, not purely just the sodium. And especially when it comes to osteoporosis, there's a big relationship between hyponatremia, which is not enough sodium in their intake. And when you don't have enough sodium, it actually increases your fracture risk and it has a tendency to create lower bone mineral density. And so it's funny, you will actually double the odds of having a fracture compared to normal bone reabsorption if you do not have enough sodium in your diet. Now, sometimes we get pushback of like, what about like cardiovascular, all these different types of things. Well, low salt diets can actually they can cause a big problem with that bone, but also there has been even more research about how the amount of sodium we should have. And originally we had thought less than 2 grams for sodium, and now they're kind of pushing more for 4 to 6 grams. If we have less than two, it actually increases cardiovascular mortality. And if you have more than seven, it tends to lead to more cardiovascular events. So it's kind of like that nice in between, just like it was for the calcium and the phosphorus. Now, as far as potassium goes, if you have low potassium, it actually will correlate again with poor bone density, especially in postmenopausal women. They actually did like a study with a big group of Korean women, and I actually have linked it in the notes below. So if you want to kind of dive into that a little bit more, it's really interesting to kind of see that. But they also did a study with people who did not have osteoporosis, and they did a 2 year supplementation of potassium, and they showed that enhanced bone density. So that's good to know for like our folks who are not in that osteopenia, osteoporosis realm, but maybe they're more in their like 40s or 50s, maybe like a little premenopausal kind of period, that might be something we might encourage. Now, especially when it comes to um, s- uh, magnesium, that's the next one we're going to go to. Magnesium has been a really nice one because it is really important not only for like recovery and sometimes even sleep components, depending on the type that you're taking. It is super important for like enzymatic reactions. So that includes supporting bone and cartilage growth. So we definitely want to kind of promote magnesium. And honestly, most people are not getting enough magnesium, especially the populations that we tend to serve. It tends to not be as readily available in their diet, or just not one that's as important when they come to supplementation. So that would definitely be something I would highly encourage you kind of look a little bit into for this group. And then the last one is zinc. So it facilitates DNA and protein synthesis and in the skeleton, and that helps stimulate the osteoblastic cells. So if you remember from way back in anatomy, osteoclasts are the ones that break it down, osteoplasts are the ones that build it up. So we definitely want to have a good relationship between the osteoblasts and the osteoclasts, and zinc is something that helps with that. As far as the amount for zinc, you want to be shooting for 10 to 25 milligrams. For potassium, it's 400 to 600, or I'm sorry, 3.5 to 5 grams. And then for magnesium, it's 400 to 600. So just to kind of recap what the levels are for each of the ones that we talked about 1 gram for calcium, 4 to 6 grams for sodium, 3.5 to 5 for potassium, 400 to 600 milligrams for magnesium, and then 10 to 25 milligrams for zinc. So those are just kind of like the top 5 when it comes to electrolytes that we really like promoting when it comes to osteoporosis. Obviously, we are not nutritionists, so if there is like specificity about a certain situation, highly, reach out to your nutrition crew and obviously your PCP MD crew that you need to. But if people are really trying to facilitate like a more holistic approach when it comes to their osteoporosis or preventing osteoporosis, these electrolytes we want to make sure are on board. One thing that I'm going to mention that I think was really interesting is, we had talked about the sodium being such a heavy hitter on being hated for so long. And there is a really good study that I've also linked in the notes about how the problem is actually in sugar and not the salt. So they're like, we're looking at the wrong white substance. And it was interesting because it talked about with sugar, like the biggest things were inflammation and like having high blood sugar and that increasing renal acid, and then that will ultimately decrease like calcium intake, and it will increase urine calcium excretions. And so I think for so long we've kind of harped on like specific electrolytes being a problem when it comes to osteoporosis, and kind of forgotten about the sugar aspect. So that's just something I wanted to mention. If we can kind of reduce that inflammatory process for these folks and then uptick exercise, um, maximizing their diet, especially with electrolytes, and then, of course, protein. We always want to get after protein. That can be super helpful for our folks who are trying to prevent osteoporosis or are currently experiencing that and trying to get it into more of that osteopenia range. So, as far as classes that we have coming up, we have L1, which will be August 20th. L2 will start September 18th. And then we have a couple of lives coming up this month. This Saturday, we have it in Aspinwall, Pennsylvania. And then June 21st, it's in Leander, Texas. So if we haven't caught you at a live, we hope to see you there and hope y'all have a great rest of your week.